As far as are we seeing a mass fatality incident, I break that down into in two different directions. First of all, are we seeing fatalities coming to us from healthcare facilities, meaning that those fatalities and the numbers are overwhelming their ability to properly manage those diseases? And is the funeral care operations being overwhelmed that we would have to help and assist in managing those bodies? So I can tell you right now is that we haven't had those demands on us from the healthcare facilities, from the hospitals. We haven't been asked to provide, increased storage of remains at our facility. So I think that tells you that the people that are dying of COVID, they're dying in the hospital, and those remains are actually being managed properly into the funeral care facility. And the second thing is, are we seeing fatalities and people who die in the community from COVID that are not receiving healthcare and being diagnosed in the healthcare setting? So part of what we do is anyone whose death is unattended in the community that comes to the attention of the medical examiner. You mind if I take?
That's fine. We're changing the covers on the microphone after every
okay,
speaker,
perfect.
so
Yeah, you can't breathe with that.
yeah, it's hard to speak.
Okay. So the question is, are we seeing an increased number of fatalities coming to the attention of my office where we have to determine the cause and manner of death? And could there be a component of COVID that is involved in those fatalities? What we've been doing since, I think, March 17th, and we were one of the first counties to start doing this, is we're doing surveillance on all the fatalities that were coming to us that were unattended. So if someone dies at home, dies in the community of maybe natural causes, of drug use, anything that's non-violent, and comes to the attention of our office, we're doing surveillance COVID testing on those people. And I can tell you right now that we haven't seen a single positive COVID patient come to us where we're saying that that death is from COVID-19. So I think that tells you that people who are coming down with this and do need medical attention or are serious and they subsequently die from this illness, they're dying in the hospital, in the medical setting. They're not dying in the community. So, and that's something that's also, I've reached out to different counties in the area, and they've seen very few cases where they have surprise positive COVID testing on their individuals. So I just wanted you guys to be aware of where we were. Questions?
Great, thank you. Those are all interesting facts, and I think good for us to know. It's nice to know our system is working. Our healthcare system is working the way that we hoped it would, and it is not being overwhelmed, and folks are getting the medical care that they need to get. Are there any other questions for Dr. Hunter? Supervisor Elliott?
Thank you, Chair.
Arnold.
Yes, so you mentioned that the cases that are diagnosed positive for COVID are cases that are hospitalizations. So what percentage of cases do you actually make the determination on as to what the cause of death was?
Yeah, well, we have to take in consideration what's the jurisdiction of any death that's unattended in the community that isn't under the direct care of a physician. That comes to the attention of the medical examiner. So it's our job to determine cause and manner of death on those cases, and that's a large number of cases of that we need to look into. Anyone who dies in the community from violence, no matter if they receive medical care or not, that comes to the attention of the medical examiner. That's a case for us to conduct an investigation and look at to determine cause and manner of death. And it's my responsibility to be the signature of those death certificates of those individuals. So when I'm talking about cases in the community, these are people who actually die. A lot of these deaths are unexpected. There's not a physician that is that we can contact and say that he was expecting this person to die because of some underlying illness. So those cases come to my attention, and those are the ones that I'm talking about. Are any of those individuals testing positive for COVID? You can imagine, well, the question early on in March is we didn't know. We didn't know if individuals that were coming down with this were all going to seek medical attention, individuals that have a serious case of this illness. Are they going to be seeking medical attention, or are they going to basically self-treat at home? And then because of that, maybe we're going to see a spike in fatalities that we have to be responsible for determining why they died. So we thought it was best to just go ahead and just do surveillance testing of all these individuals. And we're just not seeing positives in that group. Now, COVID's out there, but it's not out there and resulting in the deaths of people out in the community. Certainly, people are dying in the hospital setting. And those are cases that are basically handled by public health in the hospital setting.
Right, thank you. Now, I think we're up to 48 now, that in that vicinity of deaths in the county attributed to COVID.
Right.
Has your office tested any of those?
Well, those are individuals that have already been tested in the hospital setting. So these people aren't dying outside of the hospital, so they're not falling under the jurisdiction of the medical examiner. Now, we have had individuals that have come to us early on in March that there was a concern about them maybe being positive for COVID, and testing was pending. And in those cases, once again, we weren't seeing positives. But those types of cases are in the hospital. They're falling outside of the jurisdiction that we control, and that's people who are dying at home or nursing facilities would be a good example. People who are dying in hospice centers. Concern is, are we seeing deaths because of COVID in that area? And we simply haven't seen that yet.
Thank you. Well, that's very interesting. So in terms of the diagnoses then of the causes of death, you just haven't seen any that have been attributed to COVID.
Right. We haven't seen a spike in the number of fatalities in general. And the deaths that we're seeing that are natural deaths in the community are the same types of deaths that we were seeing. People that have heart disease, people that may have lung disease. We're seeing a similar number of maybe drug overdose deaths. And we're still doing testing on those individuals also. But we just haven't seen positive testing from COVID and had the ability to attribute those deaths in some way to COVID. I mean, people are getting it. So what I think that's telling you is that people are getting it. It's being, infecting a large portion of your population. But those individuals find their way into the healthcare system, and they're getting treated in the healthcare system. And they're not just at home trying to treat themselves. They come to our attention.
So even in the cases of nursing home deaths, so what you're saying then is that those people who did test positive for COVID have actually been transferred to the hospitals and died there.
Yeah, so those individuals are under the care of a physician so there's testing that's done. Those individuals are under a care of a physician, and that physician is the one that's going to be certifying that death as due to this illness. We're not seeing individuals who come to our attention from, say, nursing facilities who died suddenly, unexpectedly, and then we do testing. We're not seeing positivity in those types of cases. So you really have to differentiate out cases that come to us and then cases that find their way into the healthcare system. It's a different population.
Right. Thank you.
Thank you. Supervisor Nguyen?